My name is John Noggle. On behalf of all of us here at the Center for a New American Security, I'd like to welcome you to this discussion on the important, challenging, and very, very right now question of military suicide. Our nation has now been engaged in war for more than a decade, the longest period of continuous combat in our history. The all-volunteer force has performed magnificently, but is showing signs of strain, including, troublingly, a steady increase in the number of service members who are falling by their own hand. The problem is urgent. A good friend of mine currently serving as a brigade commander has lost 5 soldiers to suicide just this calendar year. This problem demands everything we can do to solve it. Those who volunteered to serve us deserve our support when they themselves are suffering. Dr. Meg Harrell, CNAS Senior Fellow and Director of our Joining Forces Initiative, has written a policy brief titled Losing the Battle, the Challenge of Military Suicide. Losing the Battle examines this crisis dispassionately and suggests a number of solutions that may help diminish this horrific loss of our most precious national resource, the lives of our sons and daughters who have chosen to serve their country. To discuss this issue with Meg, we are honored to have back with us General Peter Cordially, Vice Chief of Staff of the United States Army. No one has worked harder or done more to solve this problem. No one has done more. Thank you, sir. We also welcome Dr. Jan Kemp, National Mental Health Program Director for the Department of Veterans Affairs, which has an important role to play in helping those who continue to carry the scars of their service after they have taken off the uniform. The panel will be moderated by Juliette Kayyem, national security columnist for the Boston Globe and a lecturer in public policy at Harvard University.
The report, which I have had an opportunity to read, is a straightforward examination of what can and should be done to address one persistent and troubling problem, suicide. As the report notes, from 2005 to 2010, service members took their own lives at a rate of approximately 1 every 36 hours. The VA estimates that a veteran dies by suicide every 80 minutes. We'll talk about drilling down on those numbers. Now, these numbers are complicated. The Army is in a different position than the Air Force or the Navy or the Coast Guard. Veterans' data is difficult to manage and understand given challenges with data collection.
I've been asked whether, for the first CNAS Joining Forces product and event, we should have led with a different topic rather than military suicide. After all, it's only a very small minority of service members and veterans that die by suicide. We feel, however, that it is too large a minority and too significant an issue to ignore, given that these tragic losses affect many individuals besides those victims. The Army Brigade Commander that Dr. Noggle mentioned recently brought his command team to CNAS for a discussion. Our conference room was overflowing with his officers who only wanted to discuss military suicide with me because they deal with this every day, because it's happening now, and because changes can occur now.
As many of you know, for the last 2.5 years, I have served as the Army's lead for integration of the ongoing efforts to reduce the incidence of suicide across our force. Back in January of 2009, then Secretary of the Army Pete Guerin and General George Casey tasked me with lowering the rate of suicides. And I approached it like I did every other challenge going back to my days as a commander at just about every level. I'm an operator, and I approached it like an operator. They wanted me to lower the rate of suicide. I was going to lower the rate of suicide. I quickly learned it wasn't that simple. In fact, the challenge of suicide has proven to be the most difficult in my 40 years in the military. I believe we've made tremendous progress in understanding these very, very complex issues and making sure that leaders and soldiers understand them. I sit through a senior review group meeting, which is once a month for 2 hours. We review every single suicide in the Army. Bonnie Carroll is normally with me every single month to go through there. We have unit level commanders, members of the medical community, all together in discussion. And I can attest, after doing this for 2 years, the circumstances surrounding each suicide are as unique as the individuals themselves. That's what makes this issue so incredibly tough to influence one way or the other.
I think as long as any veteran or service member dies by suicide, we are in fact losing the battle. But I do maintain that we've made huge strides towards winning the war over the past several years. And we will continue to do that. The VA has taken the stance that suicide prevention is based on ready access to high quality mental health care. And to that end, we've instituted a whole series of programs that I won't go into now, but certainly am available to talk to any of you about at any time. Probably the most visible access mechanism that we've instituted in the past 4 years is the Veterans Crisis Line, which now has taken over 450,000 calls into the line from veterans, families, and service members.
Thanks to all of you here and to all of those joining us nationwide via webcast for being a part of this important discussion.